Everyone, it's Ed here. Welcome to another edition of Ed Talks. And we're going to tackle one of my favorite topics all around patient experience, patient advocacy. And with us, we have Dr. Nicole Davis. Nicole, welcome to Ed Talks.
And thanks for having me.
Yeah, so thrilled to have you. And we're going to talk mostly about your book, Patient Advocacy for Dummies, best title ever. We're going to dive into that in a second. But before we get there, tell us a little bit about Dr. Nicole Davis. Like, who are you?
Sure. Great question. So my name is Nicole Davis. I am board certified patient advocate. I'm what I like to say a patient turned patient advocate. So been entrenched, I think, in the healthcare system for as long as I remember. Had the opportunity to first be a consumer, as many of us are a consumer of the healthcare system. Grew up as a kid with managing some chronic illnesses. So spent a lot of time with doctors and nurses and just the whole gamut trying to figure out what's the best way to, reach your optimal form of wellness and to maintain that. So I coupled that experience with, my opportunities to work in the healthcare system in various different roles, at like the Cleveland Clinic and places up here, as well as founding and serving as the chief advocate for my patient advocacy practice, which is called Wayfinder Patient Advocates. It's based here in Cleveland, Ohio. We focus primarily on working with patients very closely to empower them so that they can make the best decisions about their care alongside or with their providers. So just kind of like teaching them, hey, how this is the best way to communicate with your docs, or helping them navigate some of these very difficult conversations with ability to pay for their care or where to find the right care and really service their partners. Healthcare all around. That's a little bit about me.
Yeah. No, that's awesome. And obviously, Nicole, based on all that experience and starting your own advocacy firm, you had this thought about a book. So how'd the book come up, the whole idea generation of it?
Yeah. So actually it's the best story, the craziest story. I had started Wayfinder in 2020. I've been working with it for now like 4 years now. And later last year, Wiley Publishing reached out to me and said, hey, we're thinking about doing this book called Patient Advocacy for Dummies. We would love to do this with you. Is this something you'd be interested in? So at that point, it's one of those, OMG, it kind of hits you moment. This is really cool. But then also, I think as a person that never really set out to write a book, it wasn't like on my vision board or anything. I, was able to work with this amazing team and really kind of put a resource together. We put a resource together that can serve as a pocket guide, I think, for patients to put in their purse or in their bag or something, so that when they're at their doctor's appointment, they can kind of educate themselves about how they can reframe the narrative of what it means to be a consumer in the healthcare system. And that's a big thing for me, is to really try to frame it as that's what it is, right? We consume so many other services and so many other goods in our society that we don't really realize sometimes that we are consumers of the healthcare system and not just passive, patients that okay, yeah, whatever works, whatever you want to do, let's do it. You can have a vision for your care. You can obviously you have values, you have wants, you have needs, all this kind of thing. And to be able to say, hey, this is what's important to me. This is how I would like my care to align with that. How can you help me get there? And that's what we're hoping this book is going to be able to do.
Yeah, very cool. Yeah, tell us one or two key things. Yeah, because we don't want to give away the book, because we want people to talk about that in a minute. What are maybe one or two key things that many people maybe don't know, and something that the book's going to help?
Yeah. So a big piece of the book focuses on communication and the relationship building that comes with working with your clinical care team, even outside of that, right? The entities that support you administratively and financially and all of these bits and pieces that come together. How do you build a relationship to have, I think, foster a sense of resilience so that you can navigate some of these headwinds in your healthcare journey? So for me personally, especially when I was younger and trying to figure out exactly what type of, what my condition was going to be like, how it was going to affect me as I got older, I found that having that relationship of being able to say hey, this is what I understand about my condition. These are my concerns. This is, what I would like to see. How can you help me get there? Having that kind of dynamic and not necessarily being a passenger in the car of, well, I'm just going to let, everybody else kind of make the decision for me, really makes a difference. And that's a central component of this, is if you can figure out, how do I communicate to my doctors and to my care team in a way that they understand, that does foster a sense of urgency and makes what I'm saying very clear and action oriented, you can see results, I think, in a way that much more streamlined and much more in alignment with what you want them to be, as
Yeah.
opposed to, hey, here's this big emotional dump and there's nothing wrong with emotion, but emotion in the right pockets, right? Here's all this information and I don't really know what to do with it. Just please sift through it and help me get there. So yeah, that's a big takeaway, I think, from the book that
Yeah.
I'm willing to share now.
Yeah. No, that's awesome because you're right. And a lot of people don't know that. And having the book be super practical, like a patient advocacy for dummies, sounds like the great solution. So awesome. So how do people find your book or go to purchase your book?
Sure. So it will be available anywhere books are sold, which is very exciting. It's currently up for pre-order on Amazon, on barnesandnoble.com, through Wiley Official, their website as well. It will be in some, obviously, the retailers that Wiley utilizes to get their books to the masses. So learning a little bit more about that as we get closer to that published date, but it's going to be available anywhere books are sold.
Yeah, no, I'm super excited about it because I'm a big believer in it. And when I saw that you were doing this, I was like, I have to have you as a guest. We need to share it with more people because it helps everyone. And I think it helps the hospitals as well. When a patient comes in that's a little empowered and has a better understanding of the whole sort of dynamics of the ecosystem. Dr. Nicole Davis, thank you so much for being a guest on EDTalks.
Thank you for having me. I appreciate it.